13 days to go before health service delivery in the country is brought to a standstill by striking doctors. But that 13-day window is also an opportunity for the national and county governments to respond to demands by doctors.
The strike will officially begin on 7th of December 2020 for purposes of protecting their lives and equally protecting the lives of Kenyans.
Union officials saying little has been done to help them effectively execute their work with regard to treating COVID-19 patients.
As we speak, many counties do not even have oxygen, which the patients who have COVID can access.
So we cannot be talking about preparedness for 8 months and nothing is being done on the ground. All we are seeing is PR, isolation and treatment centers.
And every time we're reflecting on readiness, we're looking at, do we have enough beds? Do we have enough oxygen? Our healthcare workers trained? Are they ready, to be able to combat this disease? All these measures in terms of our skill, we are okay and we are safe and we should be able to combat this.
Additionally, the union points out that the lack of enough employed doctors has seen the existing workforce endure long hours than recommended, not only putting their lives at risk, but also that of their patients.
The same doctors who are supposed to be working in isolation and treatment centers have now been deployed to work in various departments in the hospitals, in maternities to cover shortages. And our demand is that each county must employ at least 50 doctors to cover for COVID and for the other services.
188 doctors were employed by the Ministry of Health in August. According to KMPDU, the doctors were employed on 6-month contracts with no medical cover or compensation, despite being employed to work in COVID-19 isolation centers. And unfortunately, they are yet to receive their salaries for the months they have served. And while the union needs this to quickly be resolved, they maintain that comprehensive cover for all doctors, including those in county governments, parastatals, referral facilities, as well as those who teach undergraduate and postgraduate students, is non-negotiable.
We are aware that more work needs to be done to ensure that workers working in county governments are covered, as well as aligned institutions such as universities. And so these discussions are underway together with National Treasury to ensure at the end of the day all our workers are covered.
The Parliamentary Health Committee, the Nairobi Metropolitan Services and the Ministry of Health have called for a meeting with the union on Wednesday to discuss the way forward. But until then, the union is mobilizing members to as from 7th December 2020. Raquel Muigai, Citizen TV.